Jim Ziegler here for the Brainwaves Podcast. It's not unusual for someone to forget where they ate dinner last Tuesday, where you might have left your keys, or who played whom in the Rose Bowl last January. Nowadays, many of us don't even remember each other's phone numbers or mailing addresses. These elements of memory, episodic memory, are encoded by the Papes circuit, and they're stored in areas of association cortex, which is an unbelievably complex network of nerve cells. We still don't fully understand how it works, or what happens when it doesn't work. In today's program, we'll talk about what happens when episodic memory encoding and recall crash, when they shut down, like a computer in need of rebooting. And while it's certainly frustrating when your computer breaks down on you, it can be absolutely terrifying when this happens to one's mind. Stay with us. The neurology board exam is not the easiest test in the world to take, but it doesn't have to be the hardest. And for a test that costs $2,500, it's not one you want to take twice. You'll probably want to buy a good review book or download some old lectures from residency. But let me tell you that none of this will be as comprehensive as the University of Pennsylvania's 15th annual board review course. This 2-day program in Philadelphia takes place June 4th and 5th of 2018, and it can be attended in person or online. It's intended for graduating residents and fellows, but it also provides an excellent review for those of you planning to recertify. So check out what it has to offer at penneuroboard2018.com. And if you're interested, use promo code WAVES2018 to get $150 off your registration fee. Again, the code is WAVES in all caps 2018. Today's program is brought to us by Dr. Laura Mainardi.
I'm a fourth-year neurology resident at the University of Pennsylvania, soon to be an epilepsy fellow.
And this is Laura's story.
So this is the story of my father, told through my mom's memories, as he doesn't recall a lot of the things that happened on this day that I'm about to tell you. So my mom and dad live in San Juan, Puerto Rico. My dad woke up and he felt healthy this morning. He talked to my mom. He was acting completely normal. He went to visit a friend who was in the hospital. This is a neighbor and a very close friend to the family. He was suffering from pancreatic cancer. He was very sick. So my dad went to visit him, came back at about 10 in the morning to my house, went for a jog. He decided on this day actually to start a diet, so he ran about 2 miles, which is very unusual for him. And after running, he meets up with my mom for the first time since the morning, and already looks different according to my mom. She can't really pinpoint what's wrong with him, but her first response is that he needs to eat.
Not an unreasonable response. Husband takes on a new diet, hasn't eaten yet today, takes up exercising, and he comes back looking different. So she tells him,
"Go lay down, I'm going to start cooking." This is now about around noontime. So I think he came back home at around 10 in the morning, worked out, and went to lay down, and my mom's finishing cooking for lunch. So she goes up to get him, and he asks her what he has done this day. Which is going to be a recurring thing in this story, right?
I imagine that when you're asked that question by a loved one, so what's going on today? In today's day and age, we'd find that kind of like a joke. You would not even believe that someone truly has forgotten everything that's just happened. I
agree. And I think my mom is used to be, she's a matriarch of the family, and my dad, it wouldn't be extremely uncommon for him to ask her, details of the day for some reason.
Where are my keys, honey?
Yeah, she was just like, oh, he's joking. I think that was her response, that this isn't serious, but he probably needs to eat or drink something. And my brother's actually diabetic, so her first thought is, could he be hypoglycemic?
Not a bad thought. So Laura's mother grabs some juice and crackers, puts together a small lunch for him.
And he starts eating.
He looks completely fine, by the way, throughout all this.
But he keeps repeating, what did we do today? 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 Right? So while this is happening, while he's eating, drinking water, drinking juice, the neighbors,
the family members of the person Laura's dad just visited from the hospital,
come to the house, and he didn't recall having seen them in the morning. He asked them all the questions he had asked them that morning, and they were concerned, and they told my mom that. At that point, my mom becomes concerned enough that she says, maybe we should go to the hospital. My dad feels completely fine, so he's just asking the same questions, like, what is wrong? What did we do today? And at this point, Jim, you probably think, why didn't they call their daughter the neurologist, right?
Right.
So at the time I was actually...
Unfortunately, had they tried to call Laura, they wouldn't have gotten through. Laura was working in a rural clinic in Tanzania, with no cell phone service, poor internet, with infrequent email access, no way to quickly reach her. But you see, her father had also forgotten that Laura was in Tanzania.
He used to ask my mom, call Laurita, that's what he calls me, call my daughter. And my mom keeps repeating, I can't, she's in Africa. And he doesn't recall that I am in Africa. At this point, you're starting to see that he can't recall anything that's happening in this particular day.
Did he know things kind of around the house? Did he know, he knew who his wife was? He obviously remembered you.
Yeah, he looks like a normal person, except that he kept repeating what he did during that day and couldn't recall that he went to the hospital, that he worked out. And at this point, he's eaten, he drank juice, and he's not getting better. And if anything, my mom says that he's getting worse. So, he could recall things that would happen. Initially, my mom says like in the last 10 minutes, but then it worsened to the point where he just kept repeating the same questions just 5 minutes apart.
So what's your mom think about what's happening now?
Her first thought is that he was having a stroke. And you should know, neither of my parents have any medical training. So at that point, he puts my dad in a car, drives to the nearest community hospital back home in Puerto Rico. So when he gets to the hospital, and again, my parents are not medical people, so it's unclear if anything was missed. But according to her, they did an EKG, they checked his blood pressure, which was normal, they checked his glucose levels, which were normal, and they did blood work. Unclear what type of blood work. Everything was normal. And while in the emergency department, he continues to do the same thing. Every 5 minutes, he's asking, why am I in the hospital? Why am I in the hospital? What did I do? Why am I in the hospital? What did I do today?
Obviously, your mother's anxious at this point. And I can't imagine how anxious. If, my wife, Erica, if she were in this situation, I would be panic-stricken. How was your father dealing with this?
So according to my mom, my dad is anxious when she responds to these questions, and it is obvious that there's something wrong in the fact that he's not remembering that he did all these things, but he looks completely normal, except that when you respond, he's like, why don't I remember any of these things? I mean, my mom says she thought that he was dying. She thought this was the end. She thought he was having a stroke because his memory was worsening, and she had never encountered anything like this.
Nobody in your family has had any problems with memory, dementia, cognitive impairment? No,
my grandmother currently is 93 with perfect memory, and my family members usually die of cardiac disease, and no, she's never encountered anyone with dementia. And I think her biggest concern was just the acuity of it, that he was normal in the morning, and all of a sudden, he couldn't form any new memories, and she had no way to explain that, and no one was giving her any answers. They did no intervention.
When I was hearing this story from Laura the first time, it made me think of how easy it is for us as neurologists, us as physicians, to be able to characterize somebody's mental status, to identify that there's an impairment in memory formation or recall. But for someone like Laura's mom, who has no formal medical background, has had no family member with dementia or cognitive impairment, that she'd have a really tough time putting a finger on what the problem was. And in the emergency room, she probably wasn't given much time of day when she complained about how her husband wasn't acting the same. Had a neurologist seen him, they would have recognized that acute anterograde amnesia is a neurologic emergency, and it's got a pretty short differential diagnosis.
So he gets to the hospital, and you should know that Puerto Rico has a lack of neurologists just in general, community neurologists, but neurologists that are available on call in a hospital. So he's getting to the hospital. This is probably around 3 p.m. And he was never seen by any neurologist. So he was only seen by the emergency department physician, okay? And they presumably examined him. I don't think they did a proper neurologic exam. And they did a CAT scan. And everything came back normal. They did no interventions. They didn't give him fluids. They didn't give him dextrose. They didn't do anything because nothing was wrong. And so they discharged him home.
Was your mother relieved by any of that, or more upset or anxious?
She was extremely anxious because he wasn't back to normal. Things weren't getting better. But at that point, by the time they left home, things weren't getting worse.
When I was a resident, I saw a woman in the ER who had just come from her aunt's funeral, and she was driving her family home. Husband, 2 kids. She was a healthy woman, like Laura's father, in her 50s, and was absolutely fine at the funeral. While driving down the highway, she kept missing the exit to get back to their house. Her husband, who was riding shotgun in the front seat, reminded her to take the next exit, which she missed. Then the next exit. But again, she didn't take the turn. Over and over again this happened. Her husband and their kids in the back seat asked her why she was not taking the exits, and she kept coming up with some seemingly possible story for them. Oh, I heard traffic was backed up at that turn. There was a car coming up behind me. I couldn't make it. Sorry, I was thinking about something else. Totally slipped my mind. Eventually, they got her to take the exit, but she kept missing the correct turns to direct them back to their house. After another half an hour of driving, and the tension building up in the car, it became apparent to everybody else that something was wrong. She had no idea where she was going. Eventually, her husband had to ask her to pull over to the shoulder, and he drove her straight to the ER. And that's where I first met them. But we'll get back to that story in a minute. For now, back to Laura.
My father is a professor of law, and this particular physician who examined him asked him certain detailed things about the law in Puerto Rico, and he was able to answer all those things accurately. So presumably that gave the physician the impression that he was okay. Mm-hmm. And there was no explanation to what was going on, but that he was likely getting better because his CAT scan was normal and his labs were normal. So she was given some reassurance and was sent home. I think she was especially anxious that she was unable to communicate with me. But otherwise, she knew that if things worsened, she was just going to come back.
But things didn't worsen. As a matter of fact, things got better. By the next day, Laura's dad's short-term memory had normalized.
After this day, my dad was completely normal.
Completely normal. He went back to teaching law in Puerto Rico. It was as if that day had never happened. But the thing is, it did happen. It was real. And a neurologist, someone like Laura, would have still been very concerned.
And I was extremely concerned.
But Laura was in Tanzania.
So you should know that I hear about this story 3 weeks later. Because even though I was in communication with my parents through email, they decided not to tell me what had happened. So my first question is, did he have any episodes of abnormal body movements? I know that in certain seizure semiologies, you have amnesia, especially temporal lobe seizures, right? But they're usually associated with other neurologic symptoms. So, any loss of awareness, any abnormal movements, any weakness, any numbness, any diplopia, the usual questions we ask. Any focal neurologic signs. So I asked all this of my mom, and she didn't recall any of them. She literally just kept saying he was himself. He just couldn't form any new memories and kept asking the same questions, which to me, I know that's the story of transient global amnesia, but I understand that is a diagnosis of exclusion, and it is very concerning that I wasn't there myself to examine him and that no neurologist examined him when he went to seek care. So pertinent negatives include
Transient global amnesia, or TGA, is defined by the paroxysmal and transient loss of episodic memory, and it can last up to 24 hours. Most cases resolve by 12 hours, and it comes on pretty suddenly. Laura is right that it's a diagnosis of exclusion. And yeah, you have to exclude things like hypoglycemia, which her mother did. You have to rule out things like seizures with associated post-ictal amnesia, TIA or stroke, or infectious encephalitides, particularly HSV, which preferentially affects the temporal lobes. These are also a concern. A toxic state should be more noticeable, with benzos, barbiturates, and ethanol causing more sedation and dysarthria. And if he had suffered a head injury during his run, which he didn't, a post-traumatic amnesia is also possible. But again, symptoms should entirely resolve within 24 hours. So he's discharged and he goes home.
So he goes home, and my mom says that he starts regaining the ability to form new memories by about 11 p.m. So she on purpose did not let him go to sleep. She spent the whole day with him, okay? She was supposed to work that afternoon, and she decided obviously didn't work, and she continued to ask him the same questions to see when he would recover. She says it was the worst night of her life, right? She feels completely abandoned. No one gave her answers. But that slowly he recovered, and by 11 p.m. he was fine. So my mom then allows him to go to bed.
Meanwhile, I'm in the ED, evaluating that woman who's having exactly the same symptoms, who just came back from a funeral. Constantly repeating her questions. Why are we here? What's going on? Asking me who I am, but being friendly all the while. The family, on the other hand, is a total wreck. One of her daughters is curled up in a chair next to her mother, face flushed, and trying to hide her tears. The husband has loosened his tie. And the mother, my patient, completely clueless. I tell her, we need to do some blood work, make sure that your liver is working properly, get a brain MRI. I don't think it's going to show us anything, but we're going to do it just to rule out scary things like a stroke or a tumor, and a routine EEG to look for abnormal brainwaves. Sometimes we see this kind of confusion in patients who've had a seizure. That's what I tell them. Not that anything that I said is going to be reassuring, but we send off these tests anyway. In the meantime, Laura's dad eventually goes to sleep that first night, and the following morning, it's as if nothing had ever happened.
The next day, he's completely normal.
As if it were a light switch being turned back on.
He goes to work. Again, he teaches law, so he did his whole 3-hour lecture without any trouble.
I came back to see my own patient later that evening, maybe 5 or 6 hours later, after the MRI had been done and was normal, and the blood work was also normal. And I'd expected that the routine EEG to be normal as well. I saw her family was still with her, and now she was also back to normal.
That just doesn't make sense to anyone.
Even neurologists.
That's right.
Yeah.
And how odd is that presentation? The patient can drive, but cannot recall where they're driving to.
Can drive, can see, can speak,
Correct.
can move symmetrically.
And I think that's why any internal medicine doctor or emergency department physician is going to think that this might be psychiatric. I think that's a reasonable thing. If you've never heard of TGA, you have someone that comes into your emergency department, their neurologic exam is non-focal. They are cognitively otherwise intact. They just cannot recall anything that happened for the day. I think it's reasonable to reassure someone, watch them until they get better, and then possibly think that it's something psychiatric. And I think that's what happened to my dad. And I think that's something that my dad has had to struggle with.
I found it interesting that both Laura's father and the case of the patient that I saw who was driving her family from the funeral, they both occurred right around the time of a stressful event. Laura's father visiting a friend with terminal cancer, my patient having just come from a funeral. Both patients had TGA, and both seem to have been triggered by an emotional stressor.
You know, where I'm from, having, emotional distress affect your ability to think is a little bit more acceptable, I think, than it is here. And I think that was the theory that they were having at the time.
We don't necessarily know how or why it happens, but an exaggerated emotional state has been associated with this condition. It's not purely cultural.
This is how my father is thinking about this. At that time, he has insight into what happened. He doesn't recall the events of the day at all. but he knows what my mom told him, and he knows that because he doesn't recall, that it must be real. So he's extremely concerned, and he thinks he's going crazy. That was the first thought in his mind, because he got better, and all these theories of dehydration and hypoglycemia didn't make sense to him. He pretty much had a normal day besides the emotional distress of his friend. So he thinks that he might be having a psychiatric illness.
In addition to a potential neuropsychiatric trigger, experts have proposed several other theories, all of which have very limited evidence. On the one hand, there's a thought that it could be abnormal cerebral venous drainage from the temporal lobes. Some cases of TGA appear to be provoked by Valsalva, and venous imaging has identified impaired jugular venous return more frequently in patients with TGA than in healthy controls. There's also a migraine hypothesis, since it occurs more frequently in migraineurs, perhaps as an unusual complication of cortical spreading depression. And lastly, TGA could be a manifestation of seizures. But if you've got seizures, then you've got seizures. If no cause is found, nothing's actually wrong with your brain, then you're left with TGA. But just because nothing turns out to be wrong, doesn't mean that the patients feel reassured. Laura's father didn't.
His questions to my mom kept being like, what did you tell the doctor? What did they document in their notes? Is this going to affect my professional career? Is this going to happen again? Am I going to have to stop working? I'll lose my job. I'll lose my career. How am I even going to lecture tonight? What if this happens again? Those were the thoughts running through his mind.
Those were also the very same thoughts running through the mind of my patient's husband when I met them in the ER years ago. What are we going to do with Mom? Can she go back to work? Is she going to be stuck like this forever?
And I recalled, while she's talking to me, this stereotypic presentation of a person just sounding like a, what is it, a tape recorder? Or
Like a broken record?
Broken record.
Yeah.
That's the one.
Yeah,
not tape recorded, broken record. So I recall these patients always sound like broken records. They ask the same thing because people tend to want to know the same thing. If you erase their memory, they're going to ask you the same questions because it's what they wanted to know 5 minutes ago, right? Why am I here? What did I do today? Why is it 3 p.m. and I don't know what happened?
So you're finally told about this when you get back from Tanzania. You're on the phone with your parents. You say, Mom, Dad, go to the neurologist. What happens next?
The next thing he does is try to get an appointment with a neurologist. So I already told you, in Puerto Rico, we don't have a lot of neurologists, and he could only get an appointment 4 months away from when we had this conversation. So what we did was he went to see an internal medicine doctor who was a family friend who I had the pleasure to discuss this diagnosis with. And he was able to order an MRI with contrast that was done about a month later and read as normal. I remember at the time when I spoke to
a normal neurologic exam, normal blood work, and now a normal MRI, just like in my patient. All very reassuring and pretty classic for a TGA. And thankfully, Laura's father remains in good health, even to this day.
It's been about a year and a half. He has had no recurrence. His life proceeds as normal, but he lives with the constant anxiety that this is going to happen again. I don't think anyone can help feeling like this could happen again if it already did before. And I think he lives with a constant anxiety. Every time he needs to stand in front of a class of 300 students and give a lecture, the thought of, could this happen again? And could I lose my job? And then I think he'll live with that all his life. And I think he discovered the flaws in the medical system back home, and probably in most areas of this country, in the United States. I don't think this is a problem that's isolated to Puerto Rico. I think this is anyone who doesn't live in a city with a huge tertiary care center, that they are unable to recognize this as a disease. It doesn't happen often enough that people are trained to recognize it or trained to understand what the next steps are.
Regarding next steps, the most important thing to recognize, I believe, is that TGA remains a diagnosis of exclusion. You rule out the scary things, and then you're left with transient global amnesia. And TGA has no proven treatment, so it's okay that you arrive at this diagnosis last. But although there's no real treatment for it, it by definition resolves on its own, transient global amnesia, there are some interesting tricks that you might consider the next time you see a patient with TGA. One trick leverages the enactment effect, where you ask the patient to perform a semi-complex action. By asking the patient to pretend to put on a glove, or to brush their teeth, for example, the patient will access memories of how to perform those actions. And this has been shown to effectively stimulate memory encoding and retrieval in at least one prospective study. I don't know, maybe you'll try this out with your next patient. But if you don't, at least you can reassure them that the risk of this happening again is almost zero.
I did a lot of reassurance because he just thought he was crazy. He was like, this is it, Laurita, this is the beginning of the end. I'm going to have to start seeing a psychiatrist and start taking medications for this not to happen. And I was like, hold up. I don't think this is what's going on. And I think that's a benefit that a lot of people, obviously, a privilege that a lot of people don't have.
Again, that was Dr. Laura Mainardi, sharing her family's story dealing with TGA. And this is a pretty typical example of what we see in patients with this condition. Presentations are often classic, and once the scary diagnoses are excluded, patients and families should be reassured of the high probability of a complete recovery. Now, these patients won't often remember what happened that day, not at all. Laura's mother didn't, and the woman I saw, who was driving her family from a funeral, she didn't either. But while the patient's ability to encode new memories eventually recovers, it doesn't mean that they're not going to dwell on that strange event in their past when they completely lost their mind. And that concludes this installment of the Brainwaves podcast. I'd like to thank Dr. Mainardi for sharing her family's experience dealing with TGA. And please, if you haven't taken a second to rate our show on iTunes or wherever you get your podcasts, don't forget to do this. The episode this week was produced by Dr. Mainardi and myself, Jim Siegler. Music was courtesy of Pablo Pavan, Azevedo Silva, Mont Plaisir, and Kevin MacLeod. I'm Jim Siegler in Philadelphia, and I'll talk to you again soon.